to the
Welcome.
so I'll start now with the questions. So are eating disorders common in teenagers?
Yes, they are primarily, pretty common these days. Along with anxiety disorders, we are seeing more and more children coming in the clinic with the eating disorders.
And what are the most common types?
So mostly, which I have seen in my clinical practice is either overeating and some bulimic, and more than eating disorder, which I have seen is most children with poor body image. So, that also comes along with the lot of, I've not seen anorexic in my life as in my clinical practice, but I know my colleagues have seen and we've spoken about in the discussion of the cases. But mostly I have seen with the poor body image, and I have seen children with overeating primarily.
Okay. And what are some of the signs and symptoms of eating disorders?
Right. So signs and symptoms of eating disorder can be just watching if the weight is, they are overweight for their age, they are underweight, and if they are having other mental health challenges along with that. So the children are much lower than their growth, what they should be. They are very thin, but they still think that they are not good enough and they are fat. And if they are overweight and still they don't do anything to control themselves.
The impacts of eating disorders on a person's health, like psychologically and physically.
So, see, physically, of course, it will be either you overweight or underweight. But if the impact psychological will be because any disorder, like it will impact your daily living functioning. You are kind of stuck into a pattern which is not appropriate for you. So eating disorder can manifest in, challenges in your academics functioning. It can impact your daily living relationships. It can impact your normal well-being as a whole. So, either if you're overweight, it will impact your normal functioning. Some people are getting towards the obesity and other medical health issues, high BP. And if it is your lower side, then you are actually getting into pattern which is not very healthy of, not eating properly. You're very thin, under nutrition. So either sides, it will impact you both physically and emotionally and make you dysfunctional.
And what are some of the main, like some of the key factors that contribute to the development of eating disorders in teenagers?
So see, again, causes can be many. So many of the times, what mostly we are seeing children who are coming are very emotional issues, deep-rooted emotional issues, sometimes being perpetrated by the family or the society. A lot of bullying, underlying bullying also causes children to have a lot of challenges. So, like causes can be, again, it has to be established from case to case, and underlying emotional issues can lead to eating challenges.
Okay, and what are some of the courses of action against eating disorders?
So eating disorders will also have the same action, like other disorders have, where counseling of a children, counseling of the family, management as a whole, family counseling at times, and um, individual counseling by using CBT, by managing behavior, some of the strategies in a home which can be used for the not having a dysfunctional patterns. So it's a holistic approach. Only one approach, one-on-one counseling does definitely help for older children and children who are adolescent and who want to take initiative. Otherwise, it has to be a holistic and a comprehensive approach towards it.
And how can schools contribute to preventing eating disorders in teenagers and spreading awareness?
So I think schools need to make awareness about many other social emotional issues, not only eating disorders. So eating disorder is one of the challenges adolescent goes through. Mostly we are seeing more children coming with anxiety, depression, self-harming. So if schools will start talking about mental health in general in schools, I think more and more children will be able to express themselves and not bottle up with their emotions. And having access to school counselors, if somebody needs more individual help, at least they have someone to go and talk about their issues, and it can be resolved. So again, making awareness to children and making awareness among the students about their social emotional health is very important, which schools should take up as a along with the curriculum and not disregard it completely.
Okay, and do you have anything else you would like to add? Like any points that you think are important? And
So more and more awareness will lead to more and more, not only the diagnostic, but the children who would need help will get appropriate help at a right time rather than escalating the problem. So the more awareness happens, I would add that, the whole approach should be to kind of be proactive and try doing that. It should not lead to mental health issues. So anything which is a positive environment in the home setting, positive environment in the school, children not bullying each other. So if we start children teaching kindness, gratitude, and some of the things as a part of the curriculum, I think many mental health issues can be resolved and we can have a positive well-being.
our main aim is to raise awareness on eating disorders amongst teenagers. So, do you have any ideas or suggestions which we could use?
So again, if it is only about eating disorders, I would say that, what our use of social media and being a mindful use of social media is very important. It's very easy to have access to see people who are into the, industry, which requires to be in a certain shape, in a certain way. But if we make that as a parameters, and if we think that is the only definition of beauty, so that needs to be revisited by whole as a society. So I think that if we want positive, manifestation of children not getting into any kind of a disorder, whether it's eating disorder or anything, we need to set better trends and, not promote things which are artificial in nature. I think, yes, we all need to be in a weight range, but we all can have a different weight range, and accepting diversity. We all are different, but still we are all are equal. I think that's what I would emphasize, that accepting one who you are and others accepting the one which you think is looks little different is something which awareness needs to be created.